We are asking for what is right. Are we going to win?
Yes! We actually want you all to take out your phones right now. We want you to take a minute right now, and we want him to get the message from the nurses that we are here for our patients. We're ready to bargain. Since you refuse to bargain in good faith, we are coming to your office to present our opening presentation.
We want justice for our patients. What?
We are the nurses too. A little bit louder and free. Kaiser, you can't hide. We can see your greeting sign.
We came today because Kaiser failed to come to the negotiating meeting that they said they were coming to. We gave them a lot of time, and so since they did not show up, we decided to look for them. We are delivering our opening statement to Kaiser. Kaiser's model of care fails our patients. We are here for our patients. Our patients deserve better. In the past 3 years, 18,000 registered nurses and nurse practitioners across California have seen care at Kaiser dramatically change as Kaiser moves to a model of care, having the home as the primary site of care. The model of care at Kaiser is leading to more harm and less care for our patients. Every place where registered nurses and nurse practitioners provide frontline care, we are seeing our working conditions deteriorate to the point of being harmful for our patients, and it makes us all appalled. We, the 18,000 registered nurses who work every day as patient advocates, are not okay with this model of care. Our patients deserve better.
The call center is frequently the first place where our patients contact when they need to get care. The role of the call center nurses is to determine what care our patients require. This often does not happen because the person who answers the phone is not a registered nurse and follows a pre-written script. Nurses provide critical assessment of individual patient needs that a script cannot. Our patients are often refused the opportunity to speak to a registered nurse and are then sent to the wrong level of care. Despite the clinical judgment of the nurses, our patients are often only given telephone appointments. Often our patients need a face-to-face appointment in the clinic for someone to physically examine and assess them. Both the volume of calls and the severity of illness of our patients calling the call center has increased dramatically in the past few years as Kaiser discharges our patients too early. Kaiser has set up a model of care where patients have to fight to get seen in the clinic, where patients get discharged too early, and where we are the ones on the phone struggling to get them the care that they need.
And patient advocates are not okay with this model of care. Our patients deserve better.
Kaiser has closed urgent care clinics, cut evening and weekend hours, and have forced patients into going to the emergency room where they pay high copays when no appointments are available. In the clinics, Kaiser has cut time nurse practitioners have with our patients by shortening the appointments. Our patients are rushed even though they are sicker. Kaiser refuses to recognize the importance of nurse practitioners in taking care of our patients by refusing to hire more nurse practitioners. Our patients have seen a lower level of care as Kaiser is refusing to replace our registered nurses when they leave their positions, and Kaiser wants a model where unlicensed personnel are treating our patients.
Patient advocates are not okay with this level of care. Our patients deserve better.
When our patients come in the emergency room, oftentimes we've known immediately that our patients need to be admitted and hospitalized quickly. Kaiser's model of care is preventing this from happening. Instead, our patients with blood clots who used to be admitted for monitoring are now being discharged and sent home to follow up in the clinic instead. Unmonitored blood clots can lead to harm to our patients. Our patients are being held often for more than 23 hours in the emergency room instead of being admitted because Kaiser no longer wants patients in the hospital. Patients should come to the emergency room, be stabilized and treated, not waited for hours and sent home.
for a hospital bed in the hallway. They are sitting on gurneys for hours and hours. Gurneys are not built as comfortable as the hospital beds because their main purpose is to transport patients, not to sleep on them for long periods of time. When we get sick, sleep is important in getting better. Because of the lack of staff, patients have no choice but to lay on gurneys for hours until staff become available. By the time patients get admitted, on top of what they came in for, they suffer from backaches and bed sores. In the hospital, many times patients are placed in the wrong level of care. This is a huge patient safety issue. Many patients require intensive care nursing, but are instead misplaced in general med-surg areas where they will not receive appropriate monitoring or the correct nurse-to-patient ratio. Our patients are often downgraded prematurely before they are medically ready. Kaiser doesn't want to pay for them to be in the ICU, where patients are more closely monitored. During our patients' hospital stays, they are suffering multiple transfers from room to room in a 24-hour period of time, and a lot of times that happens in the dead of night. In the past few years, more and more of our patients are inappropriately being held in outpatient observation status, even though they are in a hospital bed. These patients have the same medical issues as patients Kaiser previously admitted patients for. As registered nurses, we treat our observation patients with the same dignity as admitted patients. They have a right to be cared for, even if Kaiser's model of care doesn't count them. Kaiser's failure to categorize these patients as admitted patients can lead to them being denied paid nursing home care and forces our elderly patients to pay more, even when they can't afford it.
We, 18,000 Kaiser RNs and NPs, who work every day as patient advocates, are not okay with this model of care. Our patients deserve better.
Babies are being harmed, and some irrevocably, because there are not enough nurses to admit them for delivery. Our patients often don't have a newborn baby nursery they can send their babies to because Kaiser refuses to staff them. Due to lack of staff, managers are making the decision to send in incompetent assistant managers to run emergency codes in the neonatal intensive care and provide backup care to high-risk infants when they are not experienced to do so and often do not know how to use the equipment. Babies are being harmed due to Kaiser's model of care. We,
the 18,000 Kaiser RNs and NPs, who work every day as patient advocates, are not okay with this model of care. Our patients deserve better.
When Kaiser closed the pediatric hospital unit in Hayward for 277,000 Southern Alameda County patients over the objection of nurses and community members, we told Kaiser it would be dangerous. Several months later, Genevieve Jailani Dagatan, who was only 6 months old, died after being discharged inappropriately from the emergency department. Being discharged and the lack of a pediatric hospital unit contributed to grief for her family and suffers to this day. Let's do a moment in silence for the family of Genevieve.